2023 Practice CNA Exam Questions with Rationales. Question number 1. A patient asks for extra butter. The aide should A. Get her some butter. B. Check the diet order and give the butter if she is on a regular diet. C. Tell her that butter is not good for anyone. D. Give margarine instead because it is better for her. The correct answer is B. Check the diet order. If the resident is on a regular diet, without any fat or calorie restrictions, she can have the butter. Question number 2. A patient who is on suicide watch should be allowed to have A. A glass container of flowers in her room. B. A leather belt. C. A mirror. D. Pictures of her family. The correct answer is D. Pictures of her family. An inventory of a patient's personal items, including clothing, should always be made on admission, and unsafe items should not be placed in the room. Question number 3. A patient chokes while eating. The first thing the nursing assistant should do is A. Ask the patient if she is choking. If so, perform the Heimlich maneuver. B. Call for a licensed person. C. Slap the patient between the shoulder blades. D. Tilt the victim's head back and give 2 quick breaths. The correct answer is A. The Heimlich maneuver, also referred to as abdominal thrusts, is an emergency response technique that can save a life in seconds. It is a simple action that will often dislodge food. Question number 4. A patient who has been depressed and complaining of feeling hopeless suddenly appears happier one morning and says that everything is okay now. A good nurse aide. A. Congratulates the patient on getting better. B. Watches the patient more closely. C. Voices concern to the rest of the staff. D. B and C. The correct answer is D. A good nurse aide watches more closely and voices concern to the rest of the staff. A person with smiling depression can appear to be cheerful, optimistic, and generally happy. They may smile to attempt to hide signs of depression. Question number 5. The circulatory system consists of the A. Heart, arteries, veins, and capillaries. B. Blood vessels, arteries, veins, and capillaries. C. Heart, aorta, pulmonary vessels, and lungs. D. Blood vessels, lymph nodes, and spleen. The correct answer is A. The heart, arteries, veins and capillaries. Question number 6. It is important that dressings remain A. Tight to keep out bacteria. B. Loose to admit air. C. Clean and dry. D. Untouched until ordered removed. The correct answer is C. Clean and dry. If the dressing becomes soiled or saturated, notify the nurse. Question number 7. Drainage bags from urinary catheters should A. Be kept below the level of the bladder. B. Have clear urine, without sediment. C. Have their output measured. D. All of the above. The correct answer is D. All of the answers are correct. Always keep the urinary drainage bag below the level of the bladder to prevent urine from flowing back into the bladder from the tubing and urine bag, which could cause an infection. Nurse aides should also monitor the color and clarity of the urine and empty the drainage bag when half full and at the end of the shift. Question number 8. A patient tells a nurse's aide that the foods on her tray conflict with her religious beliefs. The nurse's assistant should A. Tell the patient that it is all that is available. B. Leave the tray there in case she changes her mind. C. Check the patient's religious preference on the chart. D. Take the tray away and notify the charge nurse. The correct answer is D. Take the tray away and notify the charge nurse. Because religious rights and cultural beliefs are protected, failure to adhere to all laws and regulations regarding religion and culture may result in legal difficulties stemming from discrimination. Question number 9. A nurse's aide notices blood in a patient's IV tubing. The aide should A. Notify the nurse. B. Do nothing, that's normal. C. Try to flush the tubing. D. Stop the IV. The correct answer is A. Notify the nurse. Most nurse aides are not legally allowed to prepare or give IV injections, or stop IV infusions. Question number 10. A patient calls the nurse's assistant and says, "Someone spilled water onto my bed." The nurse's aide observes a moist area around the patient's perineum. The nurse's aide should A. Tell the patient that she has obviously had an accident. B. Tell the patient to ask for a bedpan when she needs one. C. Change the linens and make a mental note to offer the bedpan more often. D. Ask the doctor for an order for a catheter. The correct answer is C. Clean the patient. Then change the linens and offer the bedpan more often. Assisting the resident to use the bedpan every 2 hours helps to decrease accidents. This is also referred to as bladder training. Question number 11. In report, the nurse's aide is told that one of her patients has been ordered in PO after midnight. The aide should A. Take away the water pitcher at midnight. B. Offer frequent snacks. C. Note all water the patient drinks and all output. D. Ask the patient if he is having any pain. The correct answer is A. Take away the water pitcher at midnight. NPO means nothing by mouth and is a term used to identify patients who should not receive fluid or solids by mouth. Question number 12. A patient is leaving the hospital. The family has been told to change her dressings. BID. The wife asks, what does that mean? The nurse's aide tells her to change the dressings. A. Twice a day. B. 3 times a day. C. Once a day. D. Only when needed. The correct answer is A. Twice a day. BID is a medical abbreviation meaning twice a day. Question number 13. While taking a rectal temperature, the nurse's aide should insert the thermometer and A. Go on his break. B. Hold on to the thermometer until it can be removed. C. Take care of other patients and return in 3 minutes. D. Stay in the room until it is time to read the temperature. The correct answer is B. Hold on to the thermometer until it can be removed. Care must be practiced when taking someone's temperature rectally. The rectal wall may be pierced or other pain may be caused by incorrect usage methods. Question number 14. Before performing any procedure, a nurse aide must A. Identify the patient. B. Wash your hands. C. Explain the procedure. D. All the above. The correct answer is D. All the above. Identify patients to ensure that they receive the correct treatment or procedure. Hand washing reduces the spread of germs, while explaining the procedure allows the patient time to ask questions and involves them in their care. Question number 15. A patient has a diagnosis of psoriasis. Her nurse's aide should A. Avoid contact with the highly contagious lesions. B. Wear gloves for patient care. C. Treat her the same as any other patient with a non-infectious disease. D. Wear a mask when entering the room. The correct answer is C. Treat her the same as any other patient with a non-infectious disease. Psoriasis is not contagious. The skin condition cannot be passed from one person to another. Question number 16. Which of the following will not put undue strain onto the back? A. Crossing one's legs. B. Lifting with the knees. C. Slouching. D. Twisting the back while moving patients. The correct answer is B. Lifting with the knees. Body mechanics is a term used to describe the ways we move as we go about our daily lives. It includes how we hold our bodies when we sit, stand, lift, carry, bend, and sleep. Poor body mechanics are often the cause of back problems. Question number 17. Which of the following is not true of blindness? A. Most legally blind or visually impaired people have no sight at all. B. Diabetes is a cause of blindness. C. Always identify yourself before touching a blind person. D. Ask if a blind person needs help before giving assistance. The correct answer is A. Most legally blind or visually impaired people have no sight at all is not a true statement. In fact, most people who are legally blind have some vision. Question number 18. Which of the following is not true of dementia? A. People with dementia act uncooperative to be spiteful. B. They can have hallucinations. C. People with dementia are often frightened and anxious. D. Grooming is difficult for patients with dementia. The correct answer is A. People with dementia act uncooperative to be spiteful is not true. Dementia patients who are mean and aggressive are most likely feeling fear, anger and embarrassment because they have been asked to use skills that they no longer have. Even extreme dementia behavior, such as pacing, rummaging, and wandering, should be addressed calmly and compassionately. Question number 19. Which of the following is associated with smoking? A. Pneumonia. B. Heart attacks. C. Vitamin C deficiency. D. All of the above. The correct answer is D. All of the above. Smoking causes cancer, heart disease, stroke, lung diseases, diabetes, and chronic obstructive pulmonary disease, which includes emphysema and chronic bronchitis. Smoking also increases risk for tuberculosis. Question number 20, most of our calories should come from A. Protein, B. Fats, C. Carbohydrates, D. Vitamins. The correct answer is C. Carbohydrates. The carbohydrate food group is one of three sources of nutrients and energy necessary for human survival. Carbohydrates are composed of a diverse group of foods, including grains, fruits, milk, and vegetables. Question number 21, blood-borne infections include A. Hepatitis, B. Pneumonia, C. Shingles, D. Urinary tract infection. The correct answer is A. Hepatitis. Blood-borne pathogens are viruses and bacteria that are found in the blood and can be transmitted via blood. Question number 22, diabetes is A. Common, B. Often associated with obesity and sedentary lifestyle, C. Controllable, D. All of the above. The correct answer is D. All of the above. Certain lifestyle changes can reduce the risk of diabetes. These changes include eating a nutritious diet with plenty of fiber, moving more, getting enough sleep, managing your stress levels, and avoiding smoking. Question number 23, goals of arthritis care include A. Preventing contractures, B. Decreasing inflammation and preserving joints, C. Strengthening bones and muscles, D. All of the above. The correct answer is D. All of the above. For arthritis, goals typically include improving the mobility and restoring the use of affected joints, increasing strength to supporting the joint, and preserving the ability to perform daily activities. Question number 24, which will not prevent pressure sores? A. Repositioning or turning the patient every 2 hours. B. Applying lotion to dry skin. C. Keeping bed linens clean, dry, and free of wrinkles. D. Scrubbing and rubbing the skin vigorously. The correct answer is D. Scrubbing and rubbing the skin vigorously. Prolonged rubbing on the skin makes the skin sting or burn, and you develop a mild, red rash. In severe cases, chafing will include swelling, bleeding, or crusting. Question number 25, why should heat not be applied to a diabetic resident's feet? A. The feet have more oil glands. B. Diabetics have decreased sensitivity, which means they cannot feel the heat and could cause a burn. C. Their feet are dirty. D. It makes their feet wrinkle. The correct answer is B. Diabetics have decreased sensitivity, which means they cannot feel the heat and could cause a burn. Thank you for watching. If you enjoyed the video, please like the video and subscribe to our channel. Florida Training Academy is a nurse-owned CPR and CNA training company.